When lungs are continually exposed to harmful substances like cigarette smoke and air pollution, they can get damaged. The airflow becomes obstructed, and the person can suffer from COPD. COPD, or chronic obstructive pulmonary disease, is a chronic lung disease which makes it hard for a person to breathe normally. It is the fourth deadliest disease in the world. With COPD, airways in the lungs become narrow, and air cannot pass through. One way for this to happen is chronic bronchitis. Chronic bronchitis causes inflammation in the airways, which in turn increases the production of mucus-secreting cells. This inflammation is usually caused by irritating substances like air pollution or harmful smoke. The immune system treats these irritants as attackers and causes inflammation to battle them. This constant inner battle breaks down the tiny air sacs at the end of the airways where the oxygen enters the bloodstream. During this process, called emphysema, the lungs become saggy and full of air-trapping holes. Along with breathlessness, COPD is often characterized by a chronic cough, excessive mucus production, wheezing, and chest tightness. Normal daily activities, like walking up the stairs, become hard, interfering with the well-being of a person with COPD. The most problematic aspects of COPD are complications called flare-ups. They are caused by infections or other irritants which make breathing even harder. A person suffering from COPD can end up in a hospital for weeks at a time. Another big problem with COPD is that it's often diagnosed late. Some people confuse it with smoker's cough, but this disease is much more dangerous, especially when left untreated. The diagnosis of COPD is usually done through a spirometry test, which shows how deep a person can breathe and how fast air can travel in and out of the lungs. The test is usually paired with identifying symptoms such as coughing, excessive sputum, breathlessness, and, if applicable, a smoking history of the patient. The most prevalent cause of COPD is smoking. Cigarette smoke is a major lung irritant. About 75% of the diagnosed patients are smokers or have smoked before. The body's immune system treats the inhaled cigarette smoke like an attack, and while battling it, the lungs get destroyed in the process. On the other hand, it was observed that in about 25% of cases, COPD is caused by second-hand smoke and air pollution. COPD is usually treated with inhalers and tablets, which have chemicals that widen the airways or steroids that prevent inflammation. As the symptoms worsen over time, any irritants like secondhand smoke or seasonal infections can lead to major complications. It is crucial for COPD patients to stick to their treatment plan and avoid irritants. At the same time, physical activity and special breathing exercises can help manage the disease. But the most important thing about COPD is that it is preventable. The best way to protect yourself from COPD is to quit smoking, and for non-smokers, to avoid secondhand smoke, air pollution, and getting exposed to harmful chemicals. Also, frequent lung checkups can help doctors identify the disease early on and prevent it from worsening. COPD interferes with normal breathing to a life-threatening extent. In 2016, over 250 million people around the world suffered from COPD. Are you a smoker, or have you quit smoking already? Send this video to a concerned loved one and share your thoughts in the comment section.